This is part of a video series of high-yield Comlex Level 3 topics. I just finished the exam, so if you're studying for Level 3 or even Level 2, I'll tell you exactly what you need to know without wasting your time. These are real-deal questions, and they're free. Let's start. 40-year-old man with diabetes type 2 and 1-month history of swelling around the eyes, ankles, and left testicle. Creatinine 1 year ago was 2.3 milligrams a deciliter, BMI is 32. Physical exam shows periorbital and peripheral edema. Which of the following is the most likely associated with these findings? All right, so let's just go through these. Normal range of creatinine is 0.7 to 1.2. Once you hit creatinine over 2, you've lost about 90% of your renal function. So this means he clearly has poor renal perfusion. Choice A, Fournier syndrome, aka Fournier gangrene. Wrong answer. This is gangrene of the perineum or scrotum in severe diabetics. The question will give you just black skin of the perineum and you have no idea what's going on. That's the point. It's one of those situations you need to know that surgical debridement precedes any other workup step, okay? So CT ultrasound, reasonable, not what Comlex wants. You'd also start with antibiotics immediately, and good luck if they tell you to choose between surgery and antibiotics. Comlex is known to do wacky things like that. If they do, maybe just make sure the antibiotics are appropriate. So think triple coverage, carbapenem, vanc, clinda. Another point for choice A, surgical debridement re-exploration is standard of care, serial surgical debridement. So if they ask you next best step after surgery, it's not reevaluation or re-imaging, reassessing, trending white blood cell count, trending inflammatory markers. None of those are correct. Serial surgical debridement. Choice B, hydrocele. Wrong. This is going to be a kid under the age of 1 who has testicular swelling that transilluminates. The swelling will not be reducible. Embryologically, they want you to know a patent processus vaginalis, which is an invagination of the peritoneal cavity into the scrotum. Indirect inguinal hernias, they herniate through the patent processus vaginalis as well. Those are reducible. So the testable point here, answer reassurance. What? Yeah, most close spontaneously. So you observe up to 12 months, then consider surgical closure between 12 to 18 months. Choice C, orchitis. Wrong answer. All you need to know is this is inflammation of the testes. It's going to be mumps. So remember, pom-poms, testicles are like pom-poms. That's parotitis, which is parotid gland inflammation, orchitis, and meningitis, POM. So know the vaccine schedule, and MMR is not recommended in pregnancy. It's a live vaccine. Another good point, another good test question here might be something like, what's the most important thing to counsel the parents on about this condition? And the answer would be recommend isolation. The patient needs to stay away from other people for at least 5 days after the onset of symptoms because it's a highly transmissible disease. Choice D, torsion of the appendix testes. Wrong answer. So this is not the same as testicular torsion, though on test day, it will present almost the exact same way. Look for a blue dot sign, which is a bluish discoloration on the superior testicular pole, and they will tell you that the cremasteric reflex is intact. So normally for testicular torsion, this is the key differentiating factor. There's absent cremasteric reflex. And that cremasteric reflex is palpation of the inner thigh, and you get retraction of the testicles. So the appendix testes will not have that. They will have a normal cremasteric reflex. What's going on is it's a vestigial remnant of the Mullerian duct that auto-infarcts. It's a benign process. You can do an ultrasound to establish testicular flow, but the answer will be no further management, just offer reassurance. And remember, this is another one of those cases when you're talking about testicular torsion. Remember, Comlex wants you to pick immediate surgical consult. They don't want you to do ultrasound, don't want you to pick manual detorsion. It's immediate surgical consult. Choice E, varicocele. That's the correct answer. This question is a diabetic patient. The stem here shows a diabetic patient with nephrotic syndrome, and they're basically giving you that. It seems confusing, but when you're looking at a 40-year-old with diabetes and periorbital edema, think diabetic glomerulosclerosis. If it were peds, you can think minimal change disease. So he's got periorbital and peripheral edema, and you need to know the high yield point for nephrotic syndrome is there's a loss of size and charge barrier. You're losing proteins, and that includes antithrombin 3, which makes them hypercoagulable. So look out for this patient presentation, and they'll give you a DVT, they'll give you superficial thrombophlebitis, which is a painful palpable cord in the calf. In this case, we're looking at a varicocele, okay? So anatomy, this is one of the few pieces of anatomy that's fair game across all levels. Left testicular vein enters the left renal vein at 90 degrees and then goes to the IVC. So left-sided varicoceles are more common, whereas on the right side, you don't typically get varicoceles because the testicular vein on the right drains directly to the IVC. All right, so your take home here, the point of consolidation, is nephrotic syndrome can cause hypercoagulable states due to loss of antithrombin 3 in the urine. It's going to present with a DVT, superficial thrombophlebitis, or in this case, renal vein thrombosis. And you get a varicocele as a result. So that's it. Hope it's helpful. Good luck studying. Thanks for watching.